Oh, welcome and welcome to those of us watching us later. My name is Kendall Kopchick. I'm one of the social workers here at the Orange County Department on Aging. And today I'm going to talk with you all about working caregivers and how to balance those roles as a caregiver and as someone working and having to take care of a job as well. So a couple of pieces of this that I want to go over with you all. The first is going to be communicating with your employer and how to do that in a mutually beneficial way. Potential policies that could support you as a caregiver, and how to prioritize and delegate different tasks to make your to-do list a little bit, hopefully shorter and hopefully a little bit easier to tackle. And in with that, utilizing outside help and natural supports in order to get those things on the to-do list done a little bit more smoothly. And then finally, if you've seen any presentations we have before, I always like to cover some self-care and respite and how to fit that into your schedule as a working caregiver. So the first piece about communicating with your employer, the first thing is going to be to start the conversation sooner rather than later. It's going to get a lot more messy if you wait until there's been some type of crisis and all of a sudden you need a week to take care of someone who's just had a surgery or something else like that. So letting people know as soon as it becomes relevant that you have other responsibilities outside of the office and that you need to attend to those as well. So in having that conversation, describing your situation honestly, but also remembering that you only need to share what you're comfortable with. You don't need to go into the details of your loved one's diagnosis, your relationship with them, the things they need from you, as much as you're comfortable with, being honest and telling them what's going on, but you're in control of that conversation and what you share. And the other thing that's going to make this a little bit easier on the receiver's end of this conversation, so your employer, is emphasizing your desire to be productive at work and how their flexibility is going to help you to make the most of your time at work. So a lot of times this conversation can be really intimidating for people because they feel like they're going in asking for a favor. But really what you want to do is phrase this as, you want to be able to do the best that you can at your job. And in order to do that, you do need some extra flexibility or assistance on certain tasks. And that's perfectly okay because your employer wants you to be doing a great job. And I'd say 99% of the time, they are more than willing to be flexible, especially when you start that conversation early. And to kind of keep it as a conversation, not necessarily going in and saying, I need this, this, and this, and otherwise I'm not going to be able to do my job. But discussing ways that you can meet your work responsibilities while managing your role as a caregiver. So keep that as a very fluid back and forth dialogue, and make sure that you're paying attention to what they need from you so that you can ask them to listen to what you need from them as well. That's that mutual respect piece is really important. And being open and direct when you need help. Everyone is going through something in their life. Not everyone is a caregiver when they're working, but they always have something. So being open and direct and asking when you need help is going to get you further than trying to balance more than you really can handle and then all of a sudden collapsing and really needing help when it's urgent. So being proactive, I'd say, is probably the most important piece of this, and being honest with your employer and with your coworkers, not being afraid to ask them for help as well. So potential policies in the workplace that might be able to support you, and every workplace is going to be a little bit different. They may have different policies. There are some things that should be universal across the workforce, but it's important to just make sure you're consulting with your HR or your supervisor to make sure that you're using the applicable options. So there's a couple different things that may be applicable. So the first being flex time. So if you're in a position where you're expected to work a certain number of hours in a week, but there's not necessarily any rules about being in a certain place at a certain time, seeing if there's a way that you can start earlier or work later to fit times that your loved one needs more care. So maybe the mornings are really tough with your loved one and they just need a little extra attention, a little bit of help getting ready to start the day. And maybe you need to just start a little later, but in the afternoon, you've got someone who can help you out and they're covered. That could be a good way to make that a little bit easier on you. And then the Family Medical Leave Act, or FMLA, that is a federal policy that should be applicable at every workplace. There are some, conditions and some loopholes here and there, but for the most part, the main pieces that would qualify someone is if you've been at your job for a year, and the employer has 50 or more employees. That's just their way of making sure that they're not creating an undue burden on really small organizations. But even if you don't meet those qualifications, if you've only been there 6 months, 8 months, or if your employer has 25 employees, they may still follow this policy or have something similar. So it's worth asking about. But essentially what that does is it gives you 12 weeks of unpaid job protected leave. I know unpaid is not ideal for most folks, but it is an option if you have that ability to take that. And it doesn't all have to be taken at once. Some people kind of assume that this is something that's in place if you've just had a surgery or had a child. Parental leave's a little different, but same kind of basic structure that you need 12 weeks off at once. And that's not necessarily the case. You can take a week off, or it can be used if you just need a couple hours every week. That's definitely something that can be done along that policy. So definitely worth asking about. And doing a little research on what that looks like and how that can be used in your position. And then the other thing that I know some people are going to be really sick of hearing about, but it can be helpful, is working from home. And there's actually a question that came in has this year made it a little bit easier and offered more options than earlier? So the short answer being yes. For some people, working from home can be really helpful, but on the other side of that, it can be really stressful for some folks. Some people have a hard time, creating those barriers. If I'm working from home, does that mean I'm always available? So if you do choose to utilize that option, making sure that you do set some boundaries and saying, I'm home, that means I'm available if there's an emergency, but I do still need to accomplish my responsibilities at work. So that can definitely be something that can be useful for some folks. And I know a lot of companies are starting to reevaluate those policies on work from home and allowing a lot more flexibility. So definitely something to watch as those policies are changing, and also not be afraid to make your voice known on that. If you know that your company is still kind of hesitating on, are we going to bring people back 5 days a week? Are we going to bring people back part-time? We're going to keep some people all work from home, to make your voice known about that and saying, hey, I think it would be really helpful if I had the flexibility to spend a few days at home every week. And that's how they make those decisions, because they want to retain their employees. That's a really big thing for most companies. And if that's going to help you to be more productive and to be more satisfied in that job, that'll be really ideal for everyone involved. So then prioritizing and delegating. So when you are a working caregiver, or really a caregiver of any type, prioritizing and delegating is going to be really important. So the best way to think about that, I find, is to use this little diagram here on the right. So looking at what's important, and then what is urgent, and also who it's important to and who it's urgent to. So if it's something that is really important and it's really urgent, I love this example. If your house is on fire and you're inside, that is something that's very important and it's very urgent. So that's something that's just got to get done, and it's got to get done by you right now. If it's something that is really important, but it's not really urgent right now, that's where you start to look at scheduling things in advance. And when you're thinking about that, thinking about the scheduling system that works for you. Everyone has a different method of keeping themselves organized, but thinking about what works for you, it might be having a physical calendar or a planner where you can write things down and cross them off as you do them. I've known a lot of families that have had success with having some type of a whiteboard or some big board kind of in the center of the home where there's all these different tasks that need to be done and days that some people are gone and some people are home, and it's there so everyone can see it at once, and that can be really helpful. Other people have had success with virtual calendars, so using like a Google Calendar, or I know there's lots of other apps that will do that where you can put in all your events, you can invite certain people or share your whole calendar with some people so they can see what you're doing and where you are, and ask them to cover some things and schedule some things so you can get things done in a coordinated, easy bit of time. And then things that are urgent but not really important. So if good example being someone else's urgent deadline. If something's got to get done, but it's not necessarily important to you, that's a good time to delegate something or to push it back if it's not really that important. So thinking about who you can delegate these tasks to. If you're in a position at work where you have people that you are coworkers or even that are your supervisees, that can be a good practice for you to learn how to pass some tasks on to other people. I know that can be a really challenging thing because I think, especially in the workplace, a lot of us have a really hard time relinquishing duties to another person. We want to make sure if something's going to get done, we want it to get done right, and we want to have control over it. But it's going to, in the long run, make things a lot easier if you're willing to delegate to someone. So being willing to kind of let those things go and build that trust with people, that they can get something done just as well as you can. And the other hard part being for things that are not important and that are not urgent at all, just don't do it. If it's not urgent and it's not important, be willing to let some things go and say, this isn't important, I don't need to have this done today, or really any day. So just approaching different things on your to-do list with that mindset can be really helpful in figuring out exactly what it is that needs to be done and in what order. And then in terms of kind of balancing things with your loved ones, so utilizing outside help, there's a lot of different types of outside help that you can use depending on kind of what your loved one needs. So in terms of kind of in-home help, we think about it in three different kind of buckets and categories of help. So the first being companion care. And that is someone who comes in who's primarily a social visitor. They can do a little bit of minor assistance, might be able to make lunch for someone and sit and eat with them, help them get in and out of a chair, really small things like that. But for the most part, they're just kind of there to provide that companionship and kind of be an extra set of eyes if there was some type of an emergency. The next step up from that being home care, and those are usually certified nursing assistants, sometimes licensed practical nurses, LPNs, and those are people who will provide assistance with personal care, so things like bathing and dressing and feeding, managing medications. They'll also do some other small household tasks. They'll do maybe some light cleaning, help out with some laundry. They're kind of a catch-all of different things that you may need help with around the home. Going back in a second to companion care, I should also mention those people typically do not need to have any type of certification, so they're not necessarily that certified nursing assistant CNA level. Sometimes they're even volunteers, depending on where you live and what programs are available in your area. And then this last piece is going to be home health. And that's something that's typically ordered by a doctor. It's got to be some type of skilled care or therapy, like physical therapy, occupational therapy, speech therapy. Sometimes they'll have an RN, registered nurse, come out to administer some medication or to do kind of some vital checks right after a surgery or hospitalization. So that's pretty rare, but still is helpful to have if there's been some type of a medical need for it. And then the other piece that's kind of out of home care that can be really helpful is called adult daycare. And there's a few of those in our area. The two that we have in Orange County are called Charles House in Chapel Hill and the Florence Soltis Adult Day Health Center in Hillsborough. And those are programs that provide socialization, different activities. They'll usually do a meal and maybe a snack. They can administer some medications during the day if they have midday medications that need to be taken. And they typically are a full like 9 to 5-ish day. Some will offer extended hours, let you drop off early and pick up a little late. It just depends. So there's 2 in Orange County, and there's a bunch in Durham and Wake County, depending on where you're willing to travel. And those can be really helpful for a few days a week just to kind of get someone out of the home. You've got your space, and you can kind of get things done in the home or be at work, especially now as a lot of us are hanging back to the office. And it's also really beneficial to your loved one because everyone needs a little bit of socialization. It's one of our needs as humans. And so getting that done can be really, really exciting for those folks. And we just had a question about cost of outside care. So adult daycare can run, usually I think the average is about $75 a day, some being a little more, some could be a little less, and some have scholarship programs as well, and there are other funding sources that can help out with that. And then in terms of the home care, so home health is typically covered by insurance up to a certain point. Home care can usually be anywhere between $15 and $25 an hour, depending on if you go through an agency or if you go through, like we have a directory of private caregivers that we maintain at the Department on Aging that is independently employed folks who have done, we've done reference checks and background checks on them, and they tend to be a little less expensive. And then companion care, I would say similar, could be $15 to $20 an hour, or it could possibly be done by a volunteer depending on the programs that are available in the area. The other thing we talk about when we think about utilizing some outside help is to think about the natural supports in your area. So those are the people who I think, when you talk to them about your situation, they just say, oh, well, let me know if there's anything I can do. And we're always really afraid to take people up on that offer. And I tell you not to be afraid to do that. The worst someone can say is, oh no, I can't do that. I'm busy, or I don't know how to help you with that. But it doesn't hurt to ask, especially if they've already offered. So think about the things that you need help with and who may be able to meet those needs, and think about the different types of friends you have, the different types of family and neighbors. There are some friends who may be more than willing to stay with your loved one for an hour while you go run some errands. And there are some friends who maybe you're just okay to, take a peek out the window and make sure that, someone isn't wandering outside, or can bring you a meal if you're having a really tough and busy week. So think about the things you'd like to take off your plate. A lot of times when people think about getting some outside support, they think only things that are going to benefit their loved one. But if you can get someone who, can mow your lawn, or can pick some stuff up at the grocery store for you, or can clean something at your house, that's going to free up your time so that you can pay more attention to your loved one and pay attention to their needs. So that's still a form of helping you in your caregiving journey, and it's not something to feel guilty about or to be hesitant to utilize. So some people to think about, friends and neighbors, and we talked about some family. Faith communities are definitely a very helpful resource. If you belong to a church or a synagogue or a mosque, anything like that, a lot of them have volunteer groups who are, particularly with older folks, do things like friendly visiting, or we'll do some driving and things like that. So definitely look into those options. And above all, really just, if you're comfortable, don't keep your role as a caregiver a secret. The more people know, the more people are going to be willing to help you. And it's definitely not something to be ashamed of or embarrassed about. This is a really special role that you've taken on with your loved one, and it's something that should be admired, and you shouldn't be willing to hide that. And so the last piece here, I'm going to tell you a little bit about self-care and respite. Self-care is one of my favorite topics because I think it's something very underutilized with caregivers in particular, because you are all such really amazing people who are doing this amazing caregiving job for your loved ones. So you're really focused on taking care of them. But what I want to ask you to do is to make sure that you're directing some of that care towards yourself as well. And I'm sure you've heard all the cliches and metaphors of that you can't drink from an empty cup, to put on your oxygen mask before assisting others. So you really are no good to anyone else if you're not taking care of yourself. So making sure that you're remembering that. And I love this little word cloud and all the associated words with self-care, that it's a deliberate action. It's important to your well-being, sleep and exercise and rest. It improves your mood, reduces your anxiety, all types of things like that. So it comes in many forms. I think when people think about self-care, they think, oh, it means I have to go take a vacation, or I have to go to the spa, or I have to do some really extravagant thing. And that's not at all what it has to be. I mean, yes, it's nice to take a vacation, and that can be really rejuvenating for a lot of people, but it's not always practical. And if we could all do that every month, that'd be great, but we don't always have time. So thinking about things that you can do with no matter how much free time you have. So if you have a week and you can go on a vacation, then great. If you have a day, maybe your loved one's at the adult day center, thinking about things that you enjoy that you can do in that day, whether that's to get some errands done, or to, maybe do a day doing some type of fun activity at the spa, or going to a museum that you really love, meeting some friends for lunch, something like that. If you have an hour, thinking about maybe doing some form of exercise. I know sometimes folks aren't thrilled to hear that, but all the research has shown that exercise has really good results on our mood, our physical well-being, of course, but also our emotional well-being. It's been shown to reduce anxiety, reduce depression, improve, the different neurotransmitters in your brain. So that's definitely something to think about trying to schedule it into your routine. And then if you just have 5 minutes, because sometimes on some days that's all we have, thinking about different mindfulness activities, doing something, that grounds you to the present moment, whether that be some deep breathing, or there's a lot of different recorded meditations out there that can be anywhere from 30 seconds to 20 minutes, and just taking a few minutes for yourself, or maybe that's even just 5 extra minutes in the shower to use some type of, really nice smelling body scrub that makes you feel relaxed and more cared for. So thinking about things that are important to you like that can make you feel a little bit more cared for and relaxed. And sometimes we call this respite. So anything that gives you a break and gives you time to kind of recharge and do something for yourself. So thinking about using those paid outside help, or the natural supports. If you've got some friends who can help you out for a couple hours, give you a break so you can go do some of these self-care activities that take more than a few minutes, that can be really useful. And this can be something that you set up on a regular basis. That ideally would be the best situation, because that avoids us getting to a point where we're so wound up and stressed that we just kind of collapse. We like to use a more proactive approach and kind of prevent those burnouts. But you can also put it on your calendar as needed. And it can be as often or as infrequent as you think is necessary to you. And we just had a good point come into the question and answer section, is self-care may not include the cared for person, maybe a vacation, movie, exercise alone. That's absolutely true. You're with your person all the time, taking care of them. Obviously you're doing things you enjoy with them, but making sure that you enjoy that time by yourself as well. It can be really easy to say like, oh, well, I just went to a movie. That was a self-care activity, but you weren't by yourself, or you didn't take that pressure of supervising someone else off of you. So that's a really good point. And that was everything that I had prepared. So thank you everyone for joining. I will go ahead and stop the recording so we can go through some question and answers and you all can speak freely without being recorded. But for those of you who are watching the recording later, thank you for joining us. You can always reach out to me or the Aging Helpline right here if you have any questions, and join us next time.